Hello students, the purpose of this presentation is really just to review the immune system. It's really important that you have an understanding of how the immune system works, not only for Module 2, but also throughout the course of Nursing 150. We will review in a lot of the body system's autoimmune disorders, and what that means is that the immune system is not functioning properly, and that is leading to those disease processes. So it's really a good idea to have a good understanding of how the immune system works in order to understand all those disease processes throughout, all those autoimmune disease processes throughout Nursing 150. So our body is extremely unique in the fact that it has this immune system. If you really review it and study the immune system, it's very fascinating. We have such a cool mechanism in this immune system that protects us. So there's all these microorganisms and all this bacteria, all this crazy stuff floating around in our environment, but our body has the ability to fight this off, to recognize it as foreign, to recognize it as something that's not good for us, and it can fight it off. So it's really, and it does all this without us even knowing that it's going on. So very, very cool body system, and really is one of the most important body systems that we have, this immune system. So a lot of the disease processes that we talk about in this chapter, in this module, and in a lot of the modules down the road is talking about disease processes that occur because the immune system is over-functioning, or it's functioning at inappropriate times, or it's under-functioning. So it's, like I said, it's really good to understand this body system, to understand those disease processes. We do, like I said, we have this mechanism in place to protect us. The soldiers, if you will, is what we call them, and those are the white blood cells. Many different kinds. If you can kind of pull back from maybe an anatomy class or a biology class, you'll remember that there's a lot of white blood cells, and underneath the umbrella term of white blood cells are very differentiated or specialized white blood cells that do certain jobs. They all kind of work together to fight off certain bacteria, and together they work to protect us. And I've listed some here on the slide. The T and the B lymphocytes are the ones that we will focus on for HIV when we talk about it. And then you have your neutrophils, macrophages, monocytes, eosinophils, and basophils. And just remember, I'm not sure if you've had this yet as far as a complete blood count as a lab value. Your complete blood count includes a white blood cell count. When someone asks for a CBC with a differential, what they're asking is that they take the white blood cells and they differentiate them. Okay, so maybe you have 12,000 white blood cells. Let's break that down and see how many of them are neutrophils, how many are macrophages, how many are monocytes, how many are eosinophils, and how many are basophils. The reason that a provider might do that is because they can kind of tell. It gives them a picture of maybe exactly what is the problem in the patient. If their white blood cells are elevated, they want to know maybe which one of these is most elevated. If you look on page 305 in IGGI, it's table 19.1. It differentiates all the white blood cells and kind of tells you what they are in charge of. So, for instance, if your eosinophils are elevated more than the others, then it's typically due to some kind of allergic reaction. So that tells the provider that there's some kind of an allergy or inflammation going on in that patient. Concept of self versus non-self is basically just talking about the body's ability to identify its own cells from foreign cells. So it needs to be able to identify what is the self cell so it doesn't attack that, and it wants to attack the things that are non-self. We typically refer to these as antigens, the proteins, cells that are capable of stimulating an immune response. So it's basically those non-self cells are what antigens are. So make sure you familiarize yourself with the term antigens. And just review this a little bit. It's very, very unique to the immune system that it has the ability to identify self versus non-self cells. And typically, when we talk about autoimmune disorders, we talk about a failure of the immune system to be able to then identify self versus non-self. So in autoimmune disorders, the body's typically, the immune system kind of attacks itself. It's sort of under-functioning in this area of self versus non-self. One thing to also point out is that the immune function changes as we grow older. The immune function is most efficient when we're in our 20s to 30s, and then it kind of slowly declines with increasing age. So as with older adults do have a decreased immune function, and that's a lot true of a lot of body systems, is the efficiency of a lot of our body functions kind of decrease with time, and that's just because of just the aging itself. This slide is basically kind of a good picture of how cells develop in the body. All cells stem from the bone marrow, and they are initially called stem cells. And each stem cell that's produced in the bone marrow will grow and mature to differentiate itself into a certain type of cell. So stem cells are like the baby cells. And then they sort of, depending on what they come in contact with, it's sort of like a specialized cell, say maybe a red blood cell, which is something called erythropoietin, might come in contact with one of those stem cells, kind of take it under its wing and take it with it, and it matures into a red blood cell that way. So initially all cells come from the bone marrow. They're called stem cells as baby cells, and then as they grow and mature, they go and specify, kind of like what babies do. They are taken under a wing of a certain specialty, and then they all grow up to be a certain specialty. And it's important that the most important thing to understand from this slide is that the cells come from the bone marrow. Because we'll talk about this a little bit more as we go into, I believe, Module 3 or 4 when we talk about cancer cells. And basically in the cancer cells is when these cells, as they mature, they actually mutate instead of mature into a specific kind of cell. So that's kind of why this slide is here, just for you to kind of get that basic understanding of how a cell matures, a normal cell matures. So this is kind of a review of the function of the immune system. So cool and so unique. When you think about this, we have 3 different mechanisms that our body is capable of doing. Full immunity, for most efficient immunity, all 3 of these are working like they should. Inflammation is usually that first response to an invader of the body, and that's the quickest, fastest way that it kicks in first. Inflammation does, and it is that first mechanism that we have that kicks in. Antibody-mediated immunity is very unique in itself as well. It's basically when the body identifies that non-self or an antigen. After it identifies an antigen, the B cells, which is a type of white blood cell, can actually produce something called antibodies. Make sure you're familiar with that term as well. Antibodies are basically what we build up so that and it's very specific to whatever foreign thing we were exposed to, we build these antibodies, so if that germ comes back, the body has already identified it as normal, and these antibodies can fight it off immediately before we even get it. A good example of that is a virus such as chickenpox. Most people don't get chickenpox anymore because we have a vaccine against it, but before, if we were exposed to it, your body built up antibodies for it. So once you had it, you were cool. You didn't have to worry about getting it again because your body had identified it as an antigen, made antibodies to fight it off. And so if that virus you came in contact with that virus again, you had the antibodies to fight it off. So you didn't have to worry about getting it again. So that was an antibody-mediated immunity. Cell-mediated immunity is a very adaptive. It's sort of, again, it doesn't happen right away, but as we grow older and as we sort of develop this cell-mediated immunity, it's kind of adaptive or acquired immunity. This one, the lymphocyte, the T lymphocyte cells are in charge of these, of this kind of immunity. I like to refer to the T lymphocyte cells as the big guns. So these are the guys that really do the cleanup act. They come in and really help the process of immunity. Inflammation is the first big gun that comes in, and then that kind of activates the cell-mediated immunity down the road. And these T cells, also known as killer cells, natural killer cells, are the ones that really can come in and do the cleanup job and really help the patient fight against a disease. The natural killer cells are most effective in destroying unhealthy or abnormal self cells. So what I would like for you to do, really, because these are the cells, the T cells or the natural killer cells, are the ones that are attacked by the HIV virus. So it's really important that you sort of understand the T cells and what they do and what this means to the body when the HIV virus comes in and attacks these killer T cells. On page 313 in IGI, there is a section called Cell Types Involved in Cell-Mediated Immunity. It's on page 313, like I said. There's a section about that and what that describes the T cells and what they do. So it's like half a page, basically, that talks about it. So make sure you kind of review that. I think that will help you understand HIV and what it means if these cells are attacked by an HIV virus. Okay, so just in review, make sure that you review T cells. More specifically, what a CD4 count is. This is a kind of the count that we do to see how many cells have been attacked by the HIV virus. So those are important labs that you want to make sure you understand, which sometimes it's referred to as a lymphocyte screen. So lots of different names for this. So make sure you understand what killer T cells do, what a CD4 count is, especially related to HIV, and which is also could be referred to as a lymphocyte screen. So this is just a great picture of how inflammation works to protect the body. Like I said, it is an immediate response. It is an innate natural immunity that we have all been given. If inflammation is effective enough, it can actually be the first barrier and prevent the organism from entering any further into the body. So like I said, it is usually functioning the most efficient when we're in our 20s and 30s, and as we get older, it doesn't work quite as efficiently. So we want inflammation to be working at its best in order to prevent any kind of organism from getting any further into the body. Inflammation is typically immediate but short term. It does not create any kind of immunity against repeated exposure. So it's just, like I said, immediate and short term. It's non-specific to any certain microorganisms. It's just an event that happens whenever any kind of an organism enters the body. So what happens here is the area becomes reddened, it becomes swollen maybe, and all these, once this is initiated, once the bacteria enter, all these platelets come, all this stuff happens, and then the mast cells start secreting some certain white blood cells. If you look here, neutrophils are one that are released in response to inflammation. So that's one thing, like on a CBC with DIF, if we see elevated neutrophils, we know that we have an acute inflammatory response happening. And then basically the area will get red and maybe a little swollen from all of this action that is occurring. Now, the one thing to understand is that just because you have some inflammation does not necessarily mean you have an infection. You can have inflammation separate from infection. So, and like I said, it's a normal response, and the body is trying to do its thing. So inflammation that's only been there for a day or so, we don't worry so much about, but once it continues, then we do start to get concerned that there is an infection. But it doesn't always mean that there's an infection there if we see a little bit of inflammation in a response in an area. There's a great table. Actually, it's a chart. It's chart 19.1 on page 304 in Iggy. This sort of just talks about the different parts of, it kind of explains the three processes of the immune system: the inflammation, the antibody-mediated immunity, and cell-mediated immunity. It's just kind of like a chart that kind of compares and contrasts them. So it's a really good tool to use to kind of help you understand that. So this, like I said, that chart on 19.9, and it's page 304. This slide is just another review of inflammation and just talks about the 5 cardinal manifestations of inflammation. It's the warmth, redness, swelling, pain, and decreased function. Once that has occurred and it's stayed there for over a couple of days, then we start to be concerned that there might be an infection in that area and it might need to be treated. So yes, an infection could occur as a result to an invasion of organisms. It usually is accompanied by inflammation, but inflammation can't occur without infection, and that's just a review of that statement that I've made. But yeah, infection can occur, and that's if the inflammatory response has not been effective in controlling the spread of the bacteria in the body. Just a visual for all you visual learners about how the three processes work together to create an optimal functioning immune system for us. So immunity is different from inflammation. And like I said, there's several different ways that we acquire immunity. The difference between immunity and inflammation is immunity is kind of more long-term. It happens over time. It's not something that happens immediately. We sort of develop this, and this is from the work of our white blood cells and our immune system. We develop a way to become immune. It can either, like I said, be cell-mediated or antibody-mediated. Just make sure you kind of review this, all the different ways that we develop immunity. And just know that, sometimes it happens because of transfer. We get it from our mother. Sometimes it happens from a vaccine. So lots of different ways that we acquire immunity, and it all has to work together in order for us to have a good protective immune system. And like I said, this is a really good statement here. It's a learning process of the body over time. It's just like this picture here. If you guys ever watch Survivor, you have to earn your immunity. You have to fight for it. And once you develop it, you're immune to all these diseases and germs out there, so you get to stay with the tribe. Okay, so also for Module 2, we talk about allergies and hypersensitivities. This is in Chapter 2 of Iggy. So an allergy is just basically when somebody responds to something, your body kind of identifies it as an antigen or a nuisance, and it sort of triggers that inflammatory response. Examples of that is like a peanut allergy. Most of us, when we are exposed to the oils from peanuts, your body's like, oh, that's a peanut, and that's cool. Some people, they identify the oils from a peanut as foreign, so the body kicks in an inflammatory response. It's that immediate response. It could be just the inflammation in the nares and the eyes, on the skin, that's triggered. So they start to break out. They might get a runny nose, itchy eyes. That is an inflammatory response that's related to an allergy. It's an abnormal response. Anaphylaxis is kind of taking that allergic response to the next level. It's like an allergic response on steroids. It's when your body reacts so violently to exposure to something that, like, your throat swells, your face swells, eyes swell, everything. This inflammatory response just goes insane. So that's an emergency situation, and that's like a very, very severe allergic reaction. So just make sure you have an understanding of the difference between these two. It's important to understand, if you kind of go back to the sequence of the inflammatory response, there are stages: stage 1, stage 2, stage 3 of inflammation. In stage 1, once the body recognizes something foreign, it is that initial inflammatory response. It's a vascular part, and that's when the blood vessels kind of dilate and leukocytes kind of come into this area, and the leukocytes secrete histamine, serotonin, and kinins that constrict the small vessels and then dilate the arteries to get blood flow to this area. That's what causes the redness and warmth and that increased blood flow. So that occurs in an allergic reaction as well, and that's why you see all this swelling and redness and craziness. And that's stage 1 of the inflammatory response. And the reason I mention that is that histamine response, that histamine release from the leukocytes, because a treatment for allergies frequently is something that we call antihistamines. And you've probably heard this, you've probably taken them before. So basically it blocks that histamine release, so it decreases the amount of redness, swelling, and so forth. It decreases that response a little bit. If you want to review that inflammatory response, that sequence of inflammatory response, it's on page 308 in IGGY, and that's in chapter 19. There's about a half a page or so that kind of reviews that response. This is just a picture for all you visual learners, again, to see that anaphylactic reaction, and that's just showing you that it's that person that's going to have the swollen face, red hives, their lungs, their airway is going to be affected. That's an emergency situation. The reason it is such an emergency situation is that whole airway thing. When their lungs and their bronchioles and their throats swell up, they're going to be in trouble unless we get some kind of a treatment in immediately. This calls for a very emergent drug, and that drug is called epinephrine. And what epinephrine does is it kind of constricts those vessels, and it keeps all that inflammatory response from occurring. It kind of shuts that down, and that's why you'll see people who have severe allergic, maybe to bees or peanuts or something like that, they'll carry an EpiPen with them. So just make sure you have an understanding that epinephrine is the drug of choice in an emergency situation. So full functioning of epinephrine, either given IM or IV. If they're in the hospital, we usually give it IV. If it's out in the field, they're going to get it IM. It's going to be a shot. There's little EpiPens that they carry. The effects of epinephrine are it constricts the blood vessels, so it decreases the swelling. It improves cardiac function, and it actually dilates the bronchioles, which is your lungs. It opens that up so the person can breathe. Usually the dose of epinephrine can be repeated every 5 minutes if needed until the patient is stable. There's a great chart on page 389 of IGGY. It's chart 22.2. It talks about anaphylaxis and nursing assessment and how to treat it. Make sure you kind of review that to become familiar with anaphylaxis. There's a great picture also on page 389. It's figure 22.3. It's angioedema. Angioedema is facial swelling. The eyes swell, the mouth, the lips, the tongue, and that can be in response to several different, peanuts, bees, things like that. There's a drug that is famous for a rare side effect, but ACE inhibitors can in some people cause an angioedema, which can be concerning, because anybody that has any angioedema, we are on high alert that they might lose their airway because of the swelling in the facial area and the airway. Okay, just going to talk specifically about latex allergy. It's kind of something that healthcare workers have had to deal with in the past because of the increased exposure to latex, but since the identification of latex allergy, we have decreased the amount of latex that we use in gloves and all of our equipment at the hospital and any kind of healthcare situation. So the incidence of latex allergy is declining now. It's important to understand that there are different types of allergic responses. There's type 1 through type 5. Those are outlined in table 22.1 on page 384 in your IGGY book. So a latex allergy can be a couple of different kinds, actually. Sometimes people just have a contact dermatitis that's related to just some exposure, and that just means that their hands get dry and itchy. That's a contact dermatitis related to a latex allergy. There are people who ever have a true latex allergy, and that means they have almost an anaphylactic reaction to latex. So it's important to understand that there are kind of different degrees of response to latex. The other thing that's really important is the fact that there is a documented relationship between people who have certain food allergies and latex allergy. So if you see all of these things listed here, especially kiwi, if you are doing an admission assessment on a patient and you ask them if they have any allergies and they're like, oh, I have kiwi allergies, or I'm allergic to, peaches or bananas, then you would suspect that they could have a latex allergy as well, because like I said, there is documented evidence that they are related. Then you would ask, do you have a latex allergy? If they say no, we'll put them, as no. However, we will be, again, on high alert with this patient and probably try to avoid latex allergies, just because we know that there is a true relationship between the two. Most of the equipment that we use in the hospital in most healthcare settings these days are latex free. There are certain things that are not. So just know that if you do take care of a patient somewhere with a latex allergy, they do need to be labeled as such. And I do know that in most institutions they have a latex-free cart where everything in it is latex-free, so you can make sure that you're not using and exposing them to latex at all. So in summary, it's always, always, always a good idea to review with patients their allergies. So even if allergies are already listed, if you have electronic medical record and the allergies are listed, it's always good to review that with them specifically. Again, ask them, you're only allergic to Bactrim and Self. Is that correct? Correct. Are you allergic to anything else? The other thing that you really need to do as a nurse is to make sure you update it. So if they have some kind of reaction while they're in your care, you want to make sure you add that to their allergy list. And always make sure you refer to that allergy list to make sure we're not exposing them to anything that they might have a reaction to. A couple of other drugs that we use for anaphylaxis or hypersensitivity allergies. Definitely a diphenhydramine or Benadryl is a medication that we will use now. That is a drug that we will use as a pre-medicating. If we're worried that they might have a hypersensitivity to something, we will pre-medicate them, or we'll use it as a kind of a preventive thing. And that's a histamine blocker. It does do some work in that way, that it blocks that histamine. The other thing that you need to understand about diphenhydramine is the fact that it will cause drowsiness. So they don't want to take it while they're getting ready to go to work or drive or something like that. Diphenhydramine would be something that they could take if they are going to be staying at home or getting ready to go to bed. Other medications are corticosteroids. You might know that as prednisone or Solu-Cortef, but they're steroids, and basically they're anti-inflammatory. So they work in the way of decreasing that inflammatory response. There is some side effects of steroids or prednisone. They do cause some high blood pressure. They can cause some GI upset. And they can kind of have effects on your adrenal glands, which is part of your endocrine system. So they use this cautiously. They try to use them short term. Another very, very important piece of prednisone or the corticosteroids is that they typically taper them off. You can't just stop corticosteroids cold turkey. You need to be tapered off of them, and that's because of the adrenal response of the corticoid therapy. There is a good chart on page 390, chart 22.4, that talks about drug therapy. And it talks about the anaphylaxis, and that's epinephrine. And like I said, epinephrine is your number one drug of choice for an emergency, and then you kind of have your second line drugs, which is your diphenhydramine and your corticosteroids. And that concludes this presentation for Module 2, the immune system.